We're going to grab our lightest Theraband, set it to the side, and we'll grab our foam roller and come to lie on our stomach. We'll place the forearms on the foam roller, and we're working on upper back extension. We'll do a 2 breath hold at the top. Make sure the bony protrusions of the hips are anchored to the floor, the belly button's pulled in towards the spine. You don't want excessive pressure on the low back, so really brace your abs as you lift up. And we'll pause here, inhaling through the nose, pulling the abs in, bracing, and exhaling. Inhale through the nose, pull the abs in, brace, and exhale. 2 more. Inhale, abs in, brace, exhale. And 1 more. Inhale, abs in, brace, exhale. We'll lower down slowly on our next exhale with the abs bracing. Now I'd like to move in and out of this position, no longer doing an isometric hold at the top. So inhale, prepare, exhale to lift up, inhale, and exhale, lowering back down. Notice we're moving up and down on our exhales, pausing at the bottom and the top to inhale laterally into the rib cage, pulling the navel in towards the spine, bracing the abs to control the descent and to control the lift. This is great for your upper back extensors to combat the kyphosis due to the overactivity of the rectus abdominis and the internal obliques upper fibers. Again, inhale at the bottom, brace the abs, fog a mirror with your exhale as you lift up. Pause at the top, breathing into the shoulder blades and the side body like an opera singer, pulling the abdominal wall in and bracing the abs as if you're going to be punched in the gut. Hear your breath as you lower yourself down with control. 1 more. Inhale through the nose, brace the abs, exhale, lift. Inhale, prepare to brace and control your lowering. We're going to come onto all fours. Knees will be on the roller with the toes down on the floor. Your lightest Theraband will be pinned under one hand. And we'll extend the opposite leg as the hand holding the band in the air. If this feels like too much, you can keep the toes down of the leg that's extended. If you'd like to hold it up in the air, let's send energy through the leg and flex the foot the entire time. The arm will lower and lift on a 3 count, taking it up, 2, 3, exhale, inhale, lower, 2, 3. Exhale to lift, 2, 3, inhale to lower, 2, 3. Make sure your shoulder is plugged down your back. You're keeping that sternum reaching towards the back body. Your tailbone's reaching up on the diagonal, so you have lumbar extension. Keep going with those lower and lifts, working the back of the shoulder. Breathing, lifting, 2, 3, and lowering, 2, 3. Notice if there's wobbling happening in the pelvis. Stay square. Those bony protrusions on your hips should shine like headlights towards the floor. And stay even. No hiking one hip higher than the other. The leg that's extended, the foot should be dorsiflexed. Let's go ahead and set up to do the second side. Palm of the arm extending, faces in towards the face. Fingers are long. The arm that is supported the movement, make sure the elbow is slightly bent and that your shoulder is right under your wrist, or your wrist rather is right under your shoulder, and that your knees are tracking right under your hips. As you're doing this movement, be aware of your breath. We want the breath to support the movement. So the effort is extending that arm out. When we lower, gravity helps us. So on the effort, we exhale, bracing the abs, and then we lower down. 2 more. Brace the abs to lift. Inhale to lower. Brace the abs to lift. Inhale to lower. We're going to pin the lightest Theraband under the roller, tying it into a knot on one end of the roller. Let's tie it on the non-dominant arm side, so we do our harder side first. We'll bring the knees on the roller, the ball between the knees, and we'll move into lateral flexion with a 2-breath isometric hold. So once you side bend, you'll add your bottom arm, increasing the load on the external obliques, holding it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale back to starting position. Brace the abs. Exhale, side bending, adding the bottom arm. Palms facing in, sternum reaching towards the back body, tailbone back, inner thighs engaged. One more breath here. Shoulders plugged down the back, chin retracted or turned to the side if the neck is straining. And back up. Doing great. Keep that going. Taking it to the side, bracing the abs, adding the bottom arm as the long lever, increasing the load on your external obliques and your QL. Hold for one more breath. Sternum reaching towards the back ribs, belly button pulling in towards the spine. Brace those abs to bring you back up. And we'll switch sides so you can turn your roller around, bring the knees back on it, toes tucked under, side bending to the other side. Adding that bottom arm, checking in with your breath, your abs, your inner thighs, your tailbone, little lumbar extension, shoulder blade retraction, shoulders down the back, collarbone wide, sternum reaching in towards the back body. Hear those exhales. Come back up after you do 2 breaths, doing as many repetitions as you can do with control and awareness. 10 more seconds here, using your breath, squeezing the ball, engaging the lower abdominals to support the movement. From here, we'll grab a 3-pound weight, and we're going to come to lie prone on our mat with the weight in your non-dominant arm and your dominant hand, the knuckles on the forehead, elbow out to the side. Take a moment to anchor your bony protrusions of your hips into the floor so that the pelvis is stable. Pull the abs in towards the spine, brace them and lift up, pumping the arm by your hip. Inhale, 2, 3, 4. Exhale, 2, 3, 4. One more, 2, 3, 4. Exhale, 2, 3, 4, and lower down. Again, lifting up, bracing the abs, pumping the arm by the hip with the palm facing in towards the thigh. Make sure that the movement is up an inch, down an inch, the shoulders plug down the back. The abs are remaining braced, and lower back down. We've got 2 more sets on this side. Lifting up when you're ready, bracing the abs to do so, and pulsing that arm right by the hip. Small movement, engaging the tricep. Breathing in, pulsing. Try to keep the shoulder blades together and retracted, collarbone wide, sternum reaching towards the back body, hip bones, bony protrusions of the hips heavy on the floor, anchoring that pelvis, and lower down. We'll pass the weight to the other side, switching, repeating on the other side. When you're ready, inhale, prepare, exhale, brace and lift, and pulse. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4, and hold. Inhale, brace the abs, and lower yourself back down. Let's repeat that. Thinking about your checkpoints here, continue working, remembering you're doing 2 full breaths of pulses at the top. If your neck is straining, retract your chin, take your eye focus about 1.5 feet in front of you. Plug your shoulders down your back. If you feel a lot of pressure in the low back, pull the belly button in and lift up on those muscles that stop your stream of pee. You can always come back to that pelvic floor lift to support the low back as long as the belly button is pulled in. Finish up your last set, and when you're ready, lower yourself back down. Great work.